So I agree with Abdul Rahman, maybe the expert from the audience, but the expert now is giving the talk, Abdul Rahman. Well, first of all, I would like to thank my dear friend, Dr. Fawaz Al-Mutairi, my friend throughout my life journey, for inviting me for this amazing meeting, very well organized meeting, very proud by Fawaz and the board of GIS for this high level, really an amazing meeting that represent the talented people in the region, in the Gulf and Middle East and the surrounding area. I'm very happy and proud to be Fawaz with you today. And I would like to thank the moderator and the panelists for introducing me. I changed my look today because it's woman in cardiology, so we went a bit casual. My case today is about an ASD in unusual scenario. Next, please. Okay. So, varicose vein. This is a very unusual scenario that you talk about an ASD scenario and you start with varicose vein. Varicose vein is very common in women, and also it's it's common in male, and it is dilatation of the superficial veins in the leg and in the thigh. It's usually 4 grade. All of them, they cause some cosmetic disability, but it can lead also to painful episodes from superficial vein thrombosis. Next. So the therapeutic option for varicose vein is different. So surgical and using some compressive materials, and the other thing is sclerotherapy, laser, and using of foam. Next.
From your side, yeah. Wail.
Okay. So one of the therapy is the foam therapy. They inject a foam in the vein that will cause superficial vein thrombosis. The superficial vein is not isolated from the deep vein. And the risk of DVT in such patient, in such scenario, is not that, unfortunately, is not that rare. There is at least more than 100 reported cases of DVTs in association with varicose vein therapy, especially any form of therapy associated with injection of any therapeutic material within the vein. Next. So the case I'm gonna present, she's a very healthy 50-year-old lady who is a karate trainer, slim, fit, but she had some varicose vein. So she decided to go for private clinic for sclerotherapy. And the available therapy at that hospital, at that institute, was the foam therapy. It is not the best. There is different modalities, but unfortunately, in her scenario, they gave her a foam therapy. 6 hours after giving her the foam therapy, she started to have slurring of speech, and she have some weakness in one of her left side or right side. And that is next day, it proved that there is a locomotor infarction and in the middle cerebral artery distribution. The workup for this patient revealed that there is the ultrasound inconclusive for DVT, but it doesn't mean that there is no DVT or a thrombus that was there, then it's moved. The D-dimer was a bit high. The rest of the blood work was normal. The patient had an ECG, and it revealed right bundle branch block. Whenever you see right bundle branch block, you always think about right-sided pathology. So apparently, she was not in highly specialized center for examine the patient for congenital heart disease. Anyhow, after they saw this ECG, they did an echocardiogram for the patient that revealed there is an ASD. So, from a safe procedure, which is treatment of cosmetic issue, the varicocele, to a DVT, to a thrombus that is crossed across the ASD and cause the lacunar infarction. In fact, it's middle cerebral artery infarction. The patient was fortunate. Her speech was resolved and completely normalized within 2 hours. Her weakness gradually improved to be back to her normal. But it was a big trauma for her to go through all this from a healthy lady with a karate trainer at age of 50. So that is the ASD defect from left to right. And this is by 3D. And we obviously decided to close that ASD. So this is the device within the sheath, and then so after the device release, there is, as I said, several reported cases of stroke after sclerotherapy. So a lot of people, they advocate now for any injectable therapy for varicose vein is to do a baseline echocardiogram to rule out patent foraminophilia and any kind of shunt like an ASD. Thank you very much.
Thank you, Dr. Wail.